This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Now, in this show, we talk about everything under the sun, and tonight's show is special because we're dealing with one of my personal advocacies, alternative medicine. You know, folks, these days, heart disease is the leading killer in countries like the United States and the Philippines. And traditionally, people afflicted with this illness have had very limited options, heart bypasses, angioplasties, etc., etc. Now, we at Philippines Uncut are dedicated to exploring the world of alternative medicine in the hope of discovering new modalities which may be cheaper, more effective and safer than those currently being used. And tonight we are very privileged to have with us two resource speakers who are going to discuss a technology that they claim is a solution, one of the solutions at least, to the problem of heart disease. My joining in the studio are Rommel Santos and Dr. Angelita Santa Teresa of the Integrated Laser and Complementary Medicine Center. Good evening, Rommel, and of course, Doctora.
Yes,
how are
good
you?
evening.
And,
Good evening, buddy.
Okay.
welcome to Philippines Uncut.
Thank you.
Thank you. Thank you for having us here.
Yes, and you know, as I mentioned in my opening spiel, this is really a very good topic and one of my favorite topics because you know we're helping a lot of people who have until now been very limited in their view to how they can treat heart disease, you know, and other illnesses by talking about alternative treatments. Now, let's talk about your background first. Let's start with Rommel. You are the president and owner of the Integrated Laser and Complementary Medicine, and you guys are espousing the intravenous laser therapy.
Yes.
Tell us a bit first about yourself, your background.
Well, I'm a medical technologist by education. I finished my study at Lyceum Northwestern University in Dagupan City. In 2010, my father died of heart attack, and well, it didn't kill him instantly when he had that heart attack, but it took him 2 weeks of very costly hospital bills before they told us that they can't do anything about it. Now, I'm not saying it's been, it's a miracle treatment, but when I researched about my father's condition, I thought of learn more about it, not to apply for him, but to apply for me and the rest of our family. And through research and reading a lot about it through, like the World Wide Web or the internet and other books available, I've found out about the laser or intravenous laser therapy.
Now, how did you discover this technology? Okay, you did research, but then how long from the time you started researching until the time you actually started the business here in the Philippines, the center, Integrated Laser and Complementary Medicine?
Yes. Well, initially I've met this gentleman. He's from the United States, he was operating in Australia and using laser as well, but he calls it photodynamic therapy, which is, you know, like world-known alternative solution for cancer treatment. I saw some of his patients which, you know, like they have third or fourth stage cancer, which a lot of them had improved, or, you know, they live some quality of life prior to them, you know, like dying. And from there it just interests me. I did a lot of research about it, and I brought the concept to the Philippines using the Russian technology through research. Well, the World Wide Web took me to Russia.
So this is a Russian technology.
This is a Russian technology,
okay,
yes.
Good. We'll come back to that later. But Doctora, Santa Teresa, tell us a bit about your background.
Well, I'm a medical doctor who earlier trained in the fields of dermatology, cosmetic surgery, and geriatric medicine and gerontology. It's about the aging process and the diseases of aging. Yeah. But I got sick several years back and was advised to have multiple surgeries. So I tried to look the other way. I got into alternative medicine. I took a diploma course in alternative medicine, then acupuncture, and specialized in cosmetic and INSA acupuncture. Now, how I got into this modality, Ronnie Bernardo, one of his employees, invited me to become one of the consultants in the clinic. I told him that I have to first review the materials. So they sent me the materials, and I was kind of impressed. So I wanted to find out if it really works. And since they have already a clinic in Cebu, and it has been operating for more than 2 years. Okay.
Right.
So we went there.
Yes.
We were trained there, and I saw that the patients were all satisfied. So I decided to get into the clinic.
But interesting your journey into alternative medicine, because you are a Western trained doctor, trained in conventional Western medicine, and yet your personal experience opened your eyes to alternative medicine.
Actually, even earlier when I was still a med student, I was thinking during the times that we were having these exams in pharmacology. I kept on complaining to my classmates, like, why do we have to prescribe this certain medication when it's going to give you at least 3 side effects? And then we're going to treat these side effects with another set of medications, with the patient ending up in polypharmacy. So I think during that time, there was already some spark of enlightenment.
Yes.
So,
I mean, but Rommel, as patients, I've been a patient, and I'm sure you've been a patient, and you know,
Yes.
and our experience is that when you go to a doctor's office, it's almost immediate, receta,
Yes.
prescription, take this medicine, di ba? And as the doctora said, I mean, these are chemicals. These are
Yes.
chemical-based substances, and you know, there
they
will
have
be
side effects.
right?
Yes.
I have yet to know of a synthetic drug
That has
or
no
a
side
legal
effects.
drug that has no side effect.
Kaya nga in our opening
Sad to
video,
say.
we showed it, said that natural remedies are, it's a fact, they are safer, and there is no, there are little or no side effects.
Yeah.
Okay, let's talk about your technology, intravenous laser therapy. As Rommel said, it was invented in Russia, and you brought it from Russia. How long has this tech been around? Is it a new technology?
Well, it has been around for over 40 years. But in 1996, the Russian...
1986.
Sorry, 1986, sorry, I corrected it. The Russian government actually developed the said technology, and they've actually used it in Russia and in Ukraine. And recently, well, literature says they're treating about 1.5 million patients a year using the said technology.
Yeah, continue.
Even some rich Filipino people actually goes to the likes of Germany, Russia, America, and some of them, or maybe not most of them, are actually being treated by low-level laser therapy of some sort.
This is the same thing as IBLV. IVLT. Low-level laser therapy.
Low-level laser therapy.
Okay. Okay.
LLLT, that's low-level laser
LL.
therapy, and ILBI, intravenous
Intravenous.
laser blood irradiation.
Now, my question is, how come this technology, if it is effective, how come it's not more widespread? How come we don't see this, being used widely, let's say in the Philippines or in the States or in other countries? How come it's still kind of limited to Russia or Germany? Why hasn't it spread out?
There's plenty of reason. When I first got introduced to the intravenous laser therapy, that's exactly the same question I asked the oncologist in Russia, who become one of our consultants, and like a Russian physicist, and one of them is a marketing guy. And one of the reasons that he gave me at that time of, like me having the interest in the laser therapy, it's because of the politics. Okay, and apparently there are some technologies that being invented or developed in Russia that have been sold either in Germany or in the Middle East, but they don't actually.
Of course, in the U.S. or Western markets.
They won't label it as it's from Russia.
Yes. I mean, we all know this is a fact that really, especially in the U.S., the medical industry is big business.
It's a multi-billion-dollar, it's a
Trillion
trillion-dollar business composed and really a collaboration of big pharmaceuticals, the medical schools, the hospitals, and the doctors. So they really would have, it would be in their interest to protect or to keep
their interest.
Technology like this out. Now, let's talk about, Doctora. Okay, what is intravenous laser therapy? How does this work? What is this exactly?
Okay, first of all, I would like to enlighten the televiewers about it's an acronym.
Okay.
It stands for light amplification of stimulated emission of radiation. Okay.
Wow. Okay.
Now, in comparison to the laser that most people are aware of, the ones used for aesthetic or cosmetic purposes, this is not being applied topically.
Okay.
So this is minimally invasive.
Define minimally invasive.
You're just going to make a small opening by means of the
Needle.
light-emitting diode
Okay.
attached with a needle.
Okay.
And we will be having a demo.
Yes, I understand.
later,
You brought the machine here, and we
Yes.
have a volunteer who will show us exactly how this is done to a patient. Okay, continue, Doc.
And then the laser, by means of the blood, will be distributed to the different parts of the body
All right. Now, people
at
are
a
asking.
certain wavelength,
Okay.
of
Now,
course.
people are asking. Okay, well, I mentioned earlier bypass, which is they open and they do hard bypass, and they bypass a clogged artery. Now, I also talked about angioplasty, where they put in a stent, right, and they like a little balloon, and they kind of make the opening bigger of an artery that's clogged. Now, how can a light, and in your case, in this technology, you're talking about light, which you will essentially put inside someone's vein. Now, how will this help clear whatever blockages are in the system?
The researchers, the Russian oncologists, and also the other Russian doctors who are applying this procedure, they found out the different effects that this laser induce in the body. Like, for instance, it changes the cell membrane permeability and function, as well as the structure.
All right.
And it has other changes with regard to enzymes, the structure and physical, chemical, and structure of some protein polymers.
Okay.
Also with the rheology, that's what they term it, rheology, but they are actually referring only to the blood flow.
Okay.
So with these changes, altogether, they contribute in addressing the problem of the patient cardiovascularly.
The inability of the circulatory system
Yes,
to properly function.
circulate. Yeah.
So,
For instance, most of the cardio problems may stem from hypertension.
Okay.
And the way I explain it to my patients, since I cannot use some medical terms,
Sure.
so I always try to tell them that you may compare the heart as the power, the blood vessels as the passageway, and the blood as the passenger.
Okay.
Okay? blood pressure, you're quite familiar with that, you know, the two numbers, the systolic,
And the diastolic.
diastolic.
Yeah.
Okay, so when there's something wrong with the heart, with the laser modality, this tends to increase the oxygenation and the nutrition delivery to the heart. And this equates to an increase in ATP, which is the currency of power or energy in our body.
Yeah.
So the heart would then be more able to contract or pump.
Yeah.
Okay? Now, with regard the passageway or the blood vessels.
Does this technology make it bigger or
Yes, they can help the body. They aid the body in the production of what we call nitric oxide.
All right.
Okay, or nitrogen oxide.
All right.
And this nitric oxide tends to dilate or vasodilate or make the blood vessels bigger.
Bigger.
Okay, so it's, you know how it is when you're trying to pump and you have a bigger cylinder there, it's easier,
Less
right?
pressure
And then lastly, you have the red blood cells or the blood. It makes the membranes of the blood cells, it's like oval-shaped cells.
Sure.
And if you have too much acidity in your blood, the tendency for your blood cells is to aggregate
Okay.
or form this rollu formation or coin stacking.
Okay.
And it will be difficult, you know, to be pumping muddy substance as compared to liquid substance, right? So what this modality does is to make this aggregation disperse. So there will be a smoother flow of blood.
So not just making the passageways bigger, but even making the
So that modality affects it from the power
the
point,
power point,
the heart,
the passageway,
the passageway,
Yeah.
which is the passageway, the blood vessels,
blood vessels,
and the
arteries,
passengers as well, which is the
the
blood,
blood.
itself.
So it really is an all-encompassing treatment
Yes,
for
yes.
one circular
That's how
system.
good it is.
Now, okay. Several outfits here in the Philippines, in Manila, have been promoting chelation. You know, we've heard about this technology. And is it similar to what you guys are doing, chelation?
Well, the concept with chelation and the concept in the intravenous blood laser therapy is actually the same, in my view. But I believe that the chelation, they use some sort of reagent, which
Like a
I'm
liquid,
really not
you know?
familiar
Yeah.
about, but apparently it's just to get rid of
Heavy metal
deposits in our organ. The difference is with our one, there's with our laser device, we don't use any reagent. We use purely light of a certain wavelength and power output, and that gets intravenously.
So there's no
Done.
foreign matter. You're not putting anything into the body. It's really just
Except light.
it's just light.
It's about activating your own defense mechanism.
No, okay. I'm sure a lot of people are watching now and are wondering, how can light, okay, when you apply light to the blood vessel, how can it now change the structure? I said the passageway, and how can light do all this? How can light, how is it possible light does this, Doctora?
Just what I mentioned
Yeah.
before, it affects the cellular,
The cellular membrane, okay.
And the cellular membrane, you have the membrane receptors. You know, years back, they were able to discover that the different microorganisms like the virus, the bacteria, etc., they communicate. They give signals so that they can build a fortress so that the defense system or the immune system of the patient won't be able to attack them, right?
Sure, yeah.
Now, our cells, we are living beings, right? And we are made up of living cells.
Yes.
They also communicate through those cell membranes.
And once that cell membrane, if there's something wrong with that cell membrane, then the entire system is affected.
Because there will be a miscommunication.
So basically, what this technology does is it makes the body system operate more efficiently
Yes.
to make it
There's proper communication.
among the cells.
Yes.
Very nice. Okay, let's talk about treatment. What goes on? Like how many sessions is it? I mean, how does one get treated for this? How long does it take?
Okay. When somebody walks in our clinic, we don't tell them right away that you will have, after knowing the diagnosis, no? We don't tell them right away like you're going to have 7, you're going to have 3, and you 10. No. We subject first the patient or the client to a live blood analysis. Now, as compared to your usual CBC in the
Where
hospitals.
they take a,
It's
a
more of a-
syringe full of blood,
Yes, this one needs only a drop of blood.
Wow.
Okay, and then it will tell us the story. It's
Just from a drop of blood?
Yes, it is more of qualitative. So even if the patient claims that she did not have meat for her lunch or meals, recent meals, you can see if there are cholesterol deposits there.
All from a drop of blood?
Yes.
Amazing.
It sort of reflects whatever the gastric or digestive system, immune system of the patient is.
What do you call this?
And the circulatory, of course. Live blood
live
analysis.
blood analysis.
Okay.
Is this also Russian technology?
No.
Live blood analysis?
No. This is, we just got it here.
Okay.
And then we have the digital meridian system evaluation. That is Russian technology. Okay, and it tends to depend on the findings on meridians or acupoints.
Okay.
So it also gives you the possible disorders that are already in the energy body. So what we term the diseases or disorders that are coming soon.
Okay.
Okay? Or the disorders that are already there, the current disorders.
And the possible
And
disorders.
even the possible,
Okay,
the
nice.
ones that
Very
are
good.
already present in the energy body.
Very good.
Because the physical dense body, the ones that we can touch,
Yeah.
they pattern after the energy body.
Yeah. Yeah.
Okay? And then I also request for, because it is stipulated that there will be 1 in 2.5 out of 2.5 patients that will have or suffer from cancer. So I regularly ask for that determination or that test. And then I subject the clients to face and body marks reading, which I learned from dermatology,
Yeah.
and also from Chinese medicine, the tongue diagnosis as well as the fingernail
So
diagnosis.
you guys really brought in all sorts of traditional,
I integrate my
unconventional
practice. Yeah.
diagnostic. Now, how accurate are these? Okay, because coming from a Western orientation, usually you have the executive checkup, right? You have a stress test, you have a blood test, stool, urine, X-ray, ultrasound, and that's what most people have. How accurate is this compared to that?
The different diagnostic tests will give you about 65 to 85% accuracy, but altogether they can give you as high as 90 to 95.
Wow, because then you
Yes.
bring in all
Yes.
different types of diagnosis,
And if the
you paint a
patient,
picture, a
yes,
complete picture.
if the patient tests for positive for the HCG determination,
What's HCG determination?
that's for the cancer determination. And by the way, I'm proud to tell you that a Filipino was able to introduce that kind of test.
Okay.
Yeah. So if the patient tests positive, that is number 5 up. It's if I remember right, it's up to number 9. And the patient or the client wants to know where that particular cancer cells are located,
Yeah.
then that's when I order for extra or additional laboratory
So you can even
exams.
pinpoint exactly what kind of cancer someone is predisposed to
Yes.
just by this test.
Yes.
So wow.
Well, for instance, if you have the what we call hypertrichosis lanuginosa,
What's that?
it's the kind of hair
Yeah.
that you have when you are still an infant.
All right.
Over this area,
Okay.
then chances are the patient has or is suffering from colon cancer or lung cancer.
Yeah.
So in order to further check
Yes.
which one of the two, then I can check for some growth
Yeah.
in the frenulum.
Yeah.
The frenulum is the piece of skin connecting the upper gingiva
Yeah.
to the upper lip.
And you can
Yes.
confirm then
Yes, yes.
if a person is
And for the lung part, you can look at the nails.
yes.
Okay? So if it has a different, what we call the drumstick appearance,
Yeah.
most probably it's the lungs.
Something. All right. Dr. Okay, we have to pause for a break, but we'll continue this. I have so many other questions for you guys. Don't go away because more of diagnosis and a new technology called intravenous laser therapy when Philippines Uncut returns.
This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
Now, on this show, we talk about everything under the sun, and tonight's show is special because we're dealing with one of my personal advocacies, alternative medicine. You know, folks, these days, heart disease is the leading killer in countries like the United States and the Philippines. And traditionally, people afflicted with this illness have had very limited options, heart bypasses, angioplasties, etc., etc. Now, we at Philippines Uncut are dedicated to exploring the world of alternative medicine in the hope of discovering new modalities which may be cheaper, more effective and safer than those currently being used. And tonight we are very privileged to have with us two resource speakers who are going to discuss a technology that they claim is a solution, one of the solutions at least, to the problem of heart disease. Joining us in the studio are Rommel Santos and Dr. Angelita Teresa of the Integrated Laser and Complementary Medicine Center. Good evening, Rommel, and of course, Doctora.
Yes,
how are
good
you?
evening.
And,
Good evening, buddy.
Okay.
welcome to Philippines Uncut.
Thank you.
Thank you. Thank you for having us here.
Yes, and you know, as I mentioned in my opening spiel, this is really a very good topic and one of my favorite topics because you know we're helping a lot of people who have until now been very limited in their view to how they can treat heart disease and other illnesses by talking about alternative treatments. Now, let's talk about your background first. Let's start with Rommel. You are the president and owner of the Integrated Laser and Complementary Medicine, and you guys are espousing the intravenous laser therapy.
Yes.
Tell us a bit first about yourself, your background.
Well, I'm a medical technologist by education. I finished my study at Lyceum Northwestern University in Dagupan City. In 2010, my father died of heart attack, and well, it didn't kill him instantly when he had that heart attack, but it took him 2 weeks of very costly hospital bills before they told us that they can't do anything about it. Now, I'm not saying it's been, it's a miracle treatment, but when I researched about my father's condition, I thought of learn more about it, not to apply for him.